So, how epic is epinephrine? By Dylan Otis and Kyle Olstein. Epinephrine is a cell signal that goes through three phases to carry out an action. Its three phases are reception, transduction, and a response. In reception, epinephrine binds to a G protein receptor and changes its shape. In transduction, a cascade of phosphorylation occurs and prepares the cell for a change. In response, an event is triggered and carries out an effect inside or outside of the cell. Specifically for epinephrine, its response is the release of glucose. Epinephrine stimulates the response inside the body as it releases glucose and allows the body to be prepared for an event that is about to happen. Epinephrine is more commonly known as adrenaline and is released from the medulla of the adrenal gland located above the kidney. The release of epinephrine triggers an increase in heart rate, blood pressure, strength, along with other physical effects, all preparing the body for a fight or flight response. This response basically means getting the body ready to fight or run away based on its best chance of survival. In reception, one molecule of epinephrine binds to its G protein receptor and effectively activates it by changing its shape. In the next phase of transduction, a cascade of events occur that exponentially amplify the signal of epinephrine. Let's take a more specific look at that. First, the G protein binds to the G protein receptor and changes its shape. Then GDP is released and GTP is accepted. This molecule then goes to adenylyl cyclase and activates it. Then ATP is allowed to be transformed into CAMP to go to protein kinase A. Protein kinase A then activates phosphorylase and ends the chain of transduction. Once transduction ends, response occurs. In response, 10 million molecules of glucose are released from the one molecule of epinephrine that originally bonded to the cell membrane. This is done when phosphorylase breaks down glycogen into individual glucose molecules that are released into the bloodstream or to nearby cells, giving them a rapid increase in energy. Let's look at an overview of what happens when epinephrine binds to its G protein receptor. First off, it becomes activated and changes its shape. Then the G protein binds to the receptor and becomes activated. This activated G protein then releases GDP and accepts GTP. This molecule then goes to adenylyl cyclase and activates it, allowing ATP to be transformed into CAMP. CAMP goes to protein kinase A, activates it, and allows phosphorylase to be activated. When phosphorylase is activated, it breaks down glycogen inside the cell into individual glucose molecules to be released outside of the cell. Now that we know what epinephrine does to individual cells, let's look at what it does to the body in general. It opens airways, increases blood flow around the body, increases the release of fatty acids, decreases the activity of the digestive system, increases the amount of glucose in the bloodstream, and releases hormones. These things all work together to give more glucose to the muscle and brain cells to allow them to perform their actions as effectively and rapidly as possible. Epinephrine has a few medical uses other than its natural uses in the body. The EpiPen is a device used by people who are allergic to certain substances and will open their airways in a time of an allergic reaction. In a hospital, epinephrine is used to reduce swelling and to open airways. It is also used to help patients in critical conditions as it will increase the patient's heart rate and blood glucose levels. Here's a few review questions. Read them over. What's the name of the protein epinephrine binds to? A G protein receptor. What's the response from activating phosphorylase? The breakdown of glycogen into glucose. What's another name for epinephrine? Adrenaline. What's the job of adenylyl cyclase? To create CAMP from ATP. How many times is the signal of epinephrine amplified till the release of glucose? 10 million times. Now take a look at these. What's the job of epinephrine in EpiPens? It opens airways to ease the breathing of the patient. How does epinephrine cause increased alertness in a person? It gives a person a rapid increase in blood glucose levels and gives them a jump of energy. What medical issues are benefited by the use of epinephrine? General allergic reactions. That's how epic epinephrine is. And as Mr. Anderson would say, I hope that helped.